Hello, everyone, and welcome to today's webinar on the state of birth equity. We're really excited to have you join us. And we'll be getting started shortly. We're just letting folks join us in the webinar. Greetings again. We'll get started shortly. Thanks so much for joining us today. And for folks listening to the recording, thanks so much for listening in on this important conversation on the state of birth equity. Hi, we have a few more people trickling in. I think we'll get started at 2:34 Eastern. And thank you so much for joining. Okay, we'll go ahead and get started. Again, thank you so much for joining us, and thank you to those listening to the recording. My name is Miranda Migueli. My pronouns are she, her, and I serve as the Director of Policy and Programs at Women's Funding Network. On behalf of Women's Funding Network, I'm really excited to welcome you to today's discussion. Today's webinar is entitled The State of Birth Equity, Catalyzing Place-Based Philanthropy. And I'm really excited for today's panelists and the information that'll be shared in today's discussion. I see a note in the chat, and so we can follow up on that. But anyway, I just wanted to start us off for today's agenda. I'll do a quick introduction, and then we'll turn it over to our panelists. I wanted to get started with a little bit of information about the birth equity issue in the United States. And there's some really staggering statistics displayed on this screen. But I just wanted to share that when I gave birth to my son in 2015, as a Black woman giving birth in DC, it was more dangerous to do that than it was to give birth in Syria. So this conversation is incredibly personal for me, as well as professional. And there is an important role that philanthropy can play when we're thinking about the issue of birth equity. I also wanted to kick us off with some terms. According to the World Health Organization, maternal health refers to the health of women during pregnancy, childbirth, and the postnatal period. However, for our discussion, we're going to be talking about not just women, but other birthing people. I'm going to go to the National Birth Equity Collective for their definition of birth equity. And they define it as the assurance of the conditions of optimal births for all people with a willingness to address racial and social inequalities in a sustained effort. Next, I want to share Birth Justice Research Initiative's definition of birth justice, which is the analysis of interlocking oppressions So for instance, gender, race, class, and marginalization, and action on how they influence birth experiences and birth outcomes. And last but not least, I'll use Sister Song's definition for reproductive justice, which is the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. I know our panelists today can offer very eloquent descriptions of birth equity versus birth justice versus reproductive justice and why those definitions are important and those frameworks are important. I also welcome our attendees today in the webinar to either drop in the chat your definition of birth justice or your definition of reproductive justice. And while folks are dropping those definitions in the chat, I'd like to turn things over to Wendy McWeeny, who we're really delighted to have join us today. She serves as a co-director at CHAP, which is Community Health Acceleration Partnership, and she can talk a little bit more about her background and her work. Thank you.
Thanks, Miranda. Thank you so much. I just wanted to thank all of you. The Women's Funding Network has been such a terrific partner, not just on doing this webinar together, but I've learned so much about what all of you, the members, are doing, and it's been really inspiring. And I hope this is just the beginning of our work together. As Miranda said, I'm lucky enough to co-direct the Community Health Acceleration Partnership. We're a little bit of a funky foundation. We're comprised of 3 individual philanthropists, each of whom has their own larger family foundation, but who wanted to come together to work a little bit more nimbly and catalytically through this pooled fund. And while CHAP is relatively new, we've been doing this work together in the US space for about 3 years. I've worked in philanthropy for over 2 decades. And I say that with a little bit of shame on me, because as Miranda just said, we've been doing this work for a long time as funders, trying to identify ways that philanthropic dollars can make a difference. But as those statistics reveal, we're not helping. Our outcomes in this country, as we know, are getting worse, not better. So these philanthropic dollars have not been moving the needle in the right direction. In fact, I think when we're being honest with ourselves, we could argue that many of our practices have actually harmed the effort. And so I feel lucky that we work with a group of funders who really stopped us and said, what are we doing wrong? Or how could we do better? And what's nice is through groups like this and other collaboratives, we've been able to have conversations with other funders about how maybe we've contributed to problems in the past and ways to think about a role for philanthropy that looks different. We're not a huge foundation, so we often like to work with other funders, in part because our dollars are relatively small, but more because we believe that together we can accomplish a lot more. And I think when we're really thinking about systemic change, that requires collaboration. And so as we started talking with other funders about 2 years ago, we heard a lot of the same questions being asked. What could we be doing differently? What does it mean to really center community? A lot of the rhetoric and jargon that we've all been espousing, I think when push comes to shove, we didn't actually know what the actions behind those words should look like. And so we came together and said, what if we had a summit of funders? And the word summit sounds a little bit more grandiose. I mean, really it was an excuse to just come together and kind of learn from one another, as we say here, unlearn. I think really be honest about what practices needed to be let go of, and really essentially have an opportunity to learn from and hear from community-based organizations that were doing this work, and not necessarily the, what would I say, the usual suspects, really looking for organizations that were very small, but with great proximity to the challenges that we're also invested in addressing. And so as you'll see on the slide, these are some of our awesome partners in crime who were willing to come together. And at first, I have to admit, we had people telling us, we tried to do this in past years. We got a dozen people, we got 24 people. Well, in October of 2022, we had over 100 representatives from philanthropic partners come together to really rethink our role in advancing birth equity. In addition to learning from many of the CBOs, as I discussed, we really thought about how we move forward. I feel really lucky. We have a great collaborative group called Funders for Birth Justice and Equity, who are going to kind of continue to carry this work forward in concert with a field advisory committee, people, again, who have more proximity to the challenges, who lead CBOs, who are going to help direct this group of funders. And what are some of the things we're trying to do? One is just to make it easier for people to access philanthropic dollars. We've been doing a lot of work lately at looking at what does the IRS actually require? And let me tell you, it's not nearly as much as the many piles of paperwork we've historically asked grantees for. So really looking at how we get rid of some of the obstacles to accessing philanthropic dollars. We've been talking about a collaborative, almost like the College Common App, one birth equity application that maybe many funders would subscribe to, so grantees could just do one. We're also looking at the issue of sustainability. We all know that philanthropic dollars are really a drop in the bucket. And we always say we'd like to have a time where there is no philanthropic community, because we don't need private dollars going towards this, because there are public dollars who have finally caught on to recognizing where investments need to be made. So we really believe in helping community-based organizations who want to access state and federal dollars. As many of you know, that's really hard. If anybody has seen a HRSA or Title V grant application, you kind of want to poke your eyes out. So we are helping to provide technical assistance to organizations so that they can take that leap, if they want, to accessing some of those public dollars, again, with the idea that will be more sustainable. So many thanks to not only the foundations here who came together to put this summit on, but we're really lucky, and I have colleagues here from Boldly Go and Afton Bloom, who were two of the organizations that not only helped put on the summit, but produced a report I'm happy to share in the chat, and also are helping to kind of carry the water going forward, as we said, to ensure that this work continues. Just want to say quickly, this next slide, after the summit, CHAP, we really thought a lot about what we can do separately. And one thing we were really inspired by is so much work going on in specific states, and seeing the value of place-based, locally driven work, but that could be network supported. So really understanding the power of place, but knowing that we don't need to recreate the wheel everywhere, and that funders do have a unique opportunity, we think, to serve as that connective tissue between what's happening in the policy and government world and what's happening in the community-based organizations who are delivering services. And that too often, even in a state like New Jersey, where we've done our most work, there's terrific policies getting passed, but they're not necessarily always being implemented in the most equitable way. And so what role can philanthropy play in coming together to, again, serve as that connective tissue, ensuring that community-based organizations and BIPOC leaders in particular are not just informing, but really playing a central role in the policies that get passed and, crucially, how they're implemented. So we created something called the State of Birth Equity. Again, really lucky to be doing this with our partners at Afton Bloom and Boldly Go, and funded with our friends at Pritzker Children's Initiative in Cambia. And what we do is go into states where there's an interest from funders and provide some of that initial infrastructure to build funder collaboratives, to identify where there might be opportunities, to really listen to community-based organizations to understand where the challenges are and where the philanthropic community can be helpful. Under the we believe understanding that collectively we can take many more risks together as funders. I know we've seen personally that, to say that you've created a community advisory committee and they've got, as we've done in New Jersey, and my colleague Cecile will speak more to, $500,000, and they'll dictate where those funds go. For some boards of trustees, it's a little bit, they're more willing to take that leap when they know other funders are also doing that. I think we found we can challenge one another in ways that we hope is moving the needle in a much more substantive and sustainable and crucially equitable way. So I just wanted to say thank you again to all of you for taking time this afternoon, to the wonderful group pulling this all together today. And Miranda, hand it back to you to introduce our awesome panelists today. Thanks so much. Miranda, are you there? I'm wondering.
I think Miranda is having some tech issues with her sound. I think I'm speaking first, so I can go ahead and jump in. No
Ashley,
problem.
thank you. I wasn't sure. Yeah,
Sorry
please.
about that. Can you hear me
Hand
now?
it over to my amazing. Oh, yay. And
Yeah, we can hear you now.
Guest
Okay,
appearance.
I apologize. I'll let Ashley introduce herself, but really excited to have us kick things off. And she serves as the executive director of IB Black Girl and is on WFN's board.
Thank you. And just for our tech folks, I do not have control over my slides, so I'm just going to say next slide if y'all could help me out in advancing. Thank you. So I am Ashley Spivey. My pronouns are she, her. This is my youngest son, a son. Go back one, please. And he will be joining us in this talk today. So hopefully he gives me time for my little 20 minutes to get this done without a lot of crying. But IB Black Girl is based in Nebraska, and we are a reproductive justice organization. And so our mission and literally why we exist is so that Black women, femmes, and girls can live wholly. Like, that's it. That's the bottom line. We want to make sure that we are able to live wholly and actualize our full potential. And we do that through a number of ways, which I will go over quickly. Next slide, please. So our areas of work, as a reproductive justice organization, we can have lots of entry points. So for some people, he is beautiful, but it's his nap time and he is not having it. So as a reproductive justice organization, there could be lots of entry points to that work. So that could be voter rights, safe and accessible housing, food security, right? Like there could be a number of things to ensure that people with reproductive systems, women, live wholly. And so for us, this is what we have identified. We look at birth justice, which is our biggest portfolio, which we will go more in depth in the next couple of slides. We look at financial freedom. So we know that economic justice is an important part of ensuring that we can actualize our full potential. And so we have a business accelerator program that we house underneath our financial freedom portfolio. Advocacy and policy is a major lever of change and threaded throughout all of our work. And then looking at resource redistribution. So we have a giving circle quasi fund, as well as we make ecosystem grants to a number of partners. And so for us, we are the only Black-led organization in the state of Nebraska that is reproductive justice focused, as well as the only reproductive justice organization. So there are some orgs that do reproductive rights and some other things. We're the only comprehensive reproductive justice org. And the demographics of our community are the 40,000 plus Black women, femmes, and girls in Nebraska. So that's who we aim to serve. Next slide, please. And so I just wanted to give like a little bit of background from my point of view of the philanthropy landscape. So I am a recovering philanthropy professional. I worked at a foundation based here in Nebraska, as well as a foundation that did national work based out of Kansas City. And so kind of bring that lens, right, and that experience to my work here. And so for us, and what I've noticed are that there are a few funders that have intentional investment priorities in this space. So there may folks that kind of touch on it, or they're like, yeah, we like your org, we'll give some money, but it's not an intentional priority that is named. A part of having a birth justice and reproductive justice lens is really to name how racial justice and liberation shows up in the work. And there are few funders, if not any, that say, this is what we do, this is how we fund, this is how we approach the work. There is no explicit strategy through major government institutions. So like in New Jersey, and I know y'all will get into it in the ways in which government and public and private partners are showing up. That's not the same here in Nebraska. We don't have a local foundation that has a ton of discretionary income for various investments in this type of work. So again, their scope is limited. And the heartland is not on people's radar, especially national funders. So when I say like the Midwest, people go to Chicago, maybe Detroit, Ohio, but we're really talking about the heartland, which is where Nebraska is situated. And it has been really hard for folks to get on board with understanding the Black maternal health crisis here. Please, next slide. And so just a little bit of background on our maternal health landscape. And so again, people think like, oh, well, it's not that bad in Nebraska, but right, behind these numbers are actual people, and it is that bad. And so we have really high rates of maternal mortality. The data has just started to come out in the last few years from our state Health and Human Services Department around what that landscape really looks like. And we have super high maternity care deserts across our state. There is still not a space where we are accessing data around maternal morbidity, those near-death experiences, which is really important, especially for Black women and other people of color that are giving birth. And so that is, again, another opportunity there that has not been capitalized on yet from a data perspective. In Douglas County, which is where the majority of IB Black Girls work is located, it's the most populated county in the state. Our Black infant mortality rate is at 12.7%, which is the highest that it's ever been, and is significantly higher than the white infant mortality rate here. And then again, as we look at this care desert and what does it mean for comprehensive care, since you know the birthing journey is a snapshot of someone's reproductive well-being, that we've lost 6 birthing units in rural hospitals. So again, as we think about what is happening in Nebraska, I think if we can catalyze movement and really address what we see here, it'll have ripple effects, and we can lift and adapt those solutions to other geographies. Next slide, please. So one of the things that I wanted to lift up and name, especially in this space, which is uber important, is that Black women and people with the capacity for pregnancy are not trusted as experts in our own lives and experiences. And this has to be a foundational piece of the work that you do around investing in reproductive justice, in birth justice, birth equity, maternal health, is that we have to be seen and trusted as experts. We have to be giving leeway for that space and that leadership to happen. A part of taking a reproductive justice approach means that we embed and embrace abolitionist values. And so that means that systems that have not served us, we need to dismantle and reimagine in a different way. And that's really important to our approach at IB Black Girl. We know that these systems, especially obstetrics, were not created for us. They were actually birthed out of the harm and torture of enslaved African women. And so what does it mean for us to still work currently, because we know that system exists, to still work within that system, while dismantling and catalyzing something different that is community-based with our leadership and with us as seen as experts. Next slide, please. And so our birth justice approach, when we think about how we do our work, we take a collective action framework to how we catalyze this movement. And so we're not a direct service provider. We're working at the system level to say, who are the partners that are doing direct service that need to be here? How can we influence this medical institution? What does it look like for this policymaker? How does this food access program fit into this, right? So we're really trying to put all the puzzle pieces together to create the system in which we can operate best. And so we do that through 4 different approaches. The first is our data research and learning. And I just want to shout out to Jessica Eule, our birth justice program manager, is in this session. And so I may ask her to unmute and bring her voice in if I forget anything, as I'm like watching my baby from over here. So under our data and research and learning, and I'm going to drop, or actually, can somebody from our logistics drop in our website to the chat for everyone so that they can peruse our website as I'm talking? Thank you for that. So under the data and research and learning, we commissioned a report called Ain't I a Woman? And we partnered with Ubuntu Research and Evaluation, that is a Black woman and queer-led organization, to help us put this together. And I want to first lift up that data is normally weaponized against our community. So for us to have an organization that aligns to our values and approaches, and again, has people that look like the folks that are most impacted, is highly important. So we commissioned this research called Ain't I a Woman? It's under our About Us if y'all want to take a look. And the research really has 13 deep dive stories. And the stories, okay, bubs. And the stories really look at the reproductive journeys of Black women in Nebraska. No one identified as non-binary or any other gender identity. And so that's why I'm using the term women explicitly right now. Yeah. And so the data really tells us and allowed for people that normally don't get to curate their own solutions of like, this is what I need in order to have reproductive well-being, to have the birth experience that I want. And so we just published this research, and we've been really utilizing this to influence direct service providers and medical institutions around, you have to hear us and hear our stories and not just rely on quantitative data to do that. And so we're really excited to be able to publish that, again, from the space of storytelling and to humanize the data points that we normally see. Outside of our data research and learning approach, we do a ton around managing different pilots in the state. So as everyone knows, doulas and community-based birth workers are like a hot topic. Everyone is thinking about how doulas can really address the Black maternal health crisis, which I don't disagree, and we didn't create it. So I also have a huge issue with saying that Black women that are at the end result of this crisis now have to solve for it and are not a part of the people actually giving care, right? Because that's not the role of doulas in that same way. And so we really try to be explicit around how doulas are one intervention and lever into addressing the Black maternal health crisis. And what does that look like when we think about embedding them in a care team, as well as it's a workforce initiative and an opportunity for Black women and folks to run their own practice, to be able to take care of their families, right? And again, this change your economic trajectory. So it fits into our economic justice work as well. And so we manage a number of doula pilots here with some of our MCOs, our Medicaid payers of the state, as well as provide consulting and thought partnership to other folks who may not have the representation or expertise combined within their organization. That's where we come in and leverage our work in that data research and learning. So under community organizing and power building, which is a super important part of our approach, we want to make this work accessible, right? Like we understand that we, even as staff, a staff full of Black women and femmes, also have privilege because we're paid to do this work, right? We have some education and academic training and, all of those things that make a difference. And so we want everyday folks that identify as Black women and people with the capacity for pregnancy to see themselves in this work wherever they are. So we try to make sure that it's accessible, from the language that we use to the events that we have. And so a piece of that is building out toolkits so that it feels very digestible when we're having these conversations, as well as from a power building standpoint. This is where our resource redistribution comes in. And so we have a giving circle quasi fund called I Be Black Girl Gives, where folks, one, can see themselves as philanthropists. So Black women and people give, we just give differently. And so we've said we are a trusted outlet to that giving. And what does it look like when we have collective power to decide where our dollars go and the interventions that are associated with those dollars, as well as thinking about how can we invest in Black women-led organizations that might not have the capacity for a grant writer. And I should say, I Be Black Girl started in 2017. We just hired staff of February of this year. We have done it with the working board, unpaid, and like a smidgen of contractors. And we've had all this outsized impact. And we don't want our experience of struggling financially and for sustainability to inhibit other Black women leaders and folks to be in that ecosystem. So we also do ecosystem grants. And that's, again, as a part of our power building. Under coalition building, we really want to think about, right, that it's not, we need everyone in the movement. Yes, we want to center Black women leadership. We want to center ideas, but we also need other folks to come along with us and say, this is important and it's a priority, even though we don't identify in the same way, or even though we don't have the same lived experience. And so from that, we have the first and only Nebraska Black Maternal Health Coalition. It's a statewide coalition with both traditional institutional partners, as well as community-based partners that come together and say, what do we want the state of Black maternal health to be in Nebraska? So Jessica leads that and is currently working on a white paper or framework that says, if you are serving Black women or folks with the capacity for pregnancy, here is your roadmap. If you are a policymaker, this is your roadmap. And this is what it looks like. Again, and 80% of that leadership are all Black women, which we are super excited about. We also, in October, have named that Nebraska Black Maternal Health Month. And so we do a number of activities in October as just a deeper dive in a way to call attention, again, to what's happening here around maternal health. And then we convene the only reproductive justice summit in the state. And so that will be happening again this October, where we have the month-wide of events and then that intentional learning and convening space at our summit. And then lastly, from our policy and advocacy approach, this is really important for us. And you know, in my journey through my political career now, which I never thought I would say, like, first I was like, oh, I'm never going to be a philanthropist. Like, I'm never going to work in philanthropy. It's not my thing. And then I had 2 careers there. Now I'm in politics. Like, I'm never dealing with politics. Now here we are dealing in advocacy and policy because it's so important. And it makes a difference in the lives of our community. Really how we can stop the weaponizing of policy and really change it and center us in the approach. And I know we've seen this year through different legislative states and sessions the harm and things that are being passed in respective states. And our goal is to ensure that, again, no matter if we are in a super conservative state, right, or liberal, like, it doesn't matter. Here's how we center Black women, femmes, and girls to give them what we need, because when we do, everyone benefits. There's ripples for everyone. And so some of our policy and advocacy wins today is we passed adjacent legislation that is similar to the Crown Act, but is based on protective classes, hair protections for the workplace and now in schools. We were semi-successful in passing postpartum coverage. We were going for the full year, and they ended up, the state legislature doing 6 months. So we're thinking about how do we go back and at least have a minimum of postpartum Medicaid expansion to 12 months, because again, we know the data and the impacts that has. We are currently going for doula reimbursement for Medicaid payers. And so our pilots and the work that we have there are influencing our policy work. We are also meeting with our new corrections director here in Nebraska to look at doulas for folks that are incarcerated and pregnant, as well as how do we change the reproductive well-being for folks while they are incarcerated, and then are looking at paid family leave as a few examples. And so again, all of our work are like tentacles. So we know that it all goes together and is super important for us to be able to do that work in that way. Next slide, please. And then lastly, I wanted to lift up from our work the Inakra Center. And so this is really to pay homage to, again, the, the bodies that were sacrificed and experimented on behalf of the field of obstetrics and how we look at a modern gynecology in that work. And so we are incubating a community-based space that not only will house our work as Ivy Black Girl, but it'll be a place for doulas and community birth workers to meet with their clients, where we have midwives that can come in and do some centering practices. And so there's not a space like that here in Nebraska. And so I know that if we can incubate a space like this in this type of environment, then we know again that we can have ripples into other communities and geographies. And so I wanted to give y'all a snapshot of what this capital campaign project that we're doing looks like. And I know funding has changed since COVID with capital campaigns, but still having place and what does that mean and how that's defined is very important for us. Next slide, please. And then lastly, I just wanted to leave y'all with a few call to actions for our work and what that looks like. And so really resource this work. Ms. Foundation, and we quote this in every grant application and everything we do, has an amazing report called Pocket Change, and it looks at the amount of dollars, philanthropic dollars, that go into women and girl of color work. And they have it broken out by race, culture, and ethnicity. And we get pennies on the dollar. Pennies, pennies. And so you have to adequately resource this work in order to see movement. And you have to make sure that you are investing in the long haul. So, right, the 1 year grants are great, you know, 6 figures, whatever that may be, but this is not going to be solved by a few grants in a few years. And so we need funders and partners that say, we are going to resource this and we are going to be committed with you for the long haul because this is important. What we can catalyze and change is accessible. This is not out of reach. And so when we have partners, philanthropic partners that are able to do that, it makes a difference. A big piece and what we've been really thinking about and centering ourselves in is emotional justice. And so Black women and Black leaders are tired. We are tired. Not only do we do this work, but we operate and navigate the world within our identities. And so we have to really invest in rest for the organizations and the staff that y'all are partnering with, because normally this work is at the consequence of us. When you talk about social justice work, it's like, how much can you turn out your, doing all these hours and have all this impact, and then that leader dies early. We see the weathering on our bodies, they burn out, right? And so we know the data around that for leaders of color, especially in the nonprofit field. And so we have to make sure that we invest in rest. And then lastly, center the folks that are most impacted. I think for us, we are unapologetic when we say Black women, girls, and femmes, because that's our experience and that's how we can impact. That's not saying Indigenous folks are not important or Latinx folks are not, but that's not where we work. We want to partner with and invest in leaders that have that shared identity for them. And so I really just want to hone in on that. You have to center us in this work when you're talking about Black maternal health. And then what does that look like? And the learnings can we carry over for other groups of color that are also navigating a crisis in their community? And so with that, I'm excited to be in conversation with y'all. Like, I feel like I've lectured for so long and it's only been 20 minutes, but I'm really excited to get questions and thoughts, and for you to hear from the rest of the amazing brilliance of Black women on this panel. So again, thank you for your time, for hearing about Ivy Black Girl and ways in which philanthropy can think about birth justice. And I will turn it back over, I think, to Miranda. Okay, back to you.
Thank you so much, Ashley. That was a really powerful and dynamic portion of today's discussion, and we're going to continue with Cecile Edwards. And I also just wanted to make a note. Thanks, folks, for the conversation in the chat and for the questions in the Q&A. We have some time carved out at the end of the presentations to answer those questions. So we see them and we will read them out, or you can raise your hand and come off mute for that portion of today's discussion. So again, really excited to welcome Cecile, who is the Senior Manager at New Jersey Birth Equity Funders Alliance.
Thank you so much, Miranda, for your introduction. And I am extremely happy to be here to share with you the work of the Alliance. Just a little bit about myself. As noted, I am the Senior Manager of the Birth Equity Funders Alliance. And I come to this work as someone who spent 7 years as a postpartum doula, several years as a paid leave leader, and a lifetime really as an advocate for women and girls, liberation and justice around issues dealing with family. And I just want to start off by giving a little bit of information about New Jersey and where New Jersey is in terms of birth equity. So New Jersey, New Jersey unfortunately spent a lot of time as the 4th worst place to give birth in the United States. So we saw the statistics for the United States in general, and in New Jersey, Black women are actually 7 times more likely to die in childbirth or from childbirth-related complications, and 55% of Black women are more likely to have preterm births than white women. And with this information and understanding this information, we are lucky to have government who is supportive of alleviating this concern. And so our First Lady, Tammy Murphy, spearheaded bringing together of community actors to create the Nurture New Jersey plan. And with this Nurture New Jersey plan, which is a compendium of solutions to this issue, we are able to work with this plan and create our own, as an alliance of funders, way to support it through supporting community-based organizations, because this is one of the points in the plan noted to be a critical piece of ensuring that maternal mortality and morbidity is reduced and eliminated, and really looking to make New Jersey one of the safest places to give birth in America. And so with that, there has been a lot of investment in various pieces of this plan. There has also been laws passed to ensure that there is a grounding of these family practices in our state as well. And so with that, the New Jersey Birth Equity Funders Alliance has worked with the Nurture New Jersey plan and supported the Nurture New Jersey plan, coming together in this spirit of collective action to ensure that we do our part to in this work as funders. And one of the best things I know when people see, some of our funders, we think of dollar signs, but I also think of the massive strengths that is brought to this work and the amount of thought partnership and the passion that is brought to this work as well. And this is why we have been able to really catalyze and get a lot of things done and provide a lot of influence in this work. And I'll talk a little bit about that coming up. So our guiding principles of the Alliance, and I'll say the Alliance or NJBEFA moving forward, by the way, instead of going through the full title. Our guiding principles is to focus on racial equity, collaborating, learning, and co-design. So ensuring that we're learning with community and in community and utilizing that learning to create programs and respond to the needs of community-based organizations. Community and CBO first approach. So again, we'll talk about our Community Advisory Committee and how the Community Advisory Committee has, and the fund that it stewards, has really been a huge piece of this work. And of course, mutual accountability. So in these spaces of learning, we can create accountability with and for one another to ensure that we are being, honest in this work and being responsive to the needs of community to ensure that these issues go away. As Wendy said earlier, we don't want to be here 100 years from now. We want to be able to provide solutions to this issue. And if there's a different issue, move on to that or just not have any at all. So just a little bit more going over the Alliance's vision and intended impacts. Again, the vision is to reduce maternal mortality in New Jersey and eliminate racial disparities in birth outcomes. As we heard, the statistics are quite dire. And in Black and Brown communities, unfortunately, they are not improving. The mission, the way in which we see doing this is through supporting community-based solutions and BIPOC-led organizations to lead efforts to address maternal mortality. So supporting those who are closest to the ground, who know what the details and the ins and outs of this crisis is, and providing them with various support, including financial support, technical assistance support, but also catalyzing their organizing and advocacy efforts. And so we talked a little bit about why community-based organizations and why we're choosing community-based organizations, or why we chose to work with community-based organizations. And there's many reasons why. CBOs play multiple roles in creating birth equity in New Jersey. So through their services, the delivery of their services and their innovation in those services, they provide programs that respond to community needs, connecting the populations that they serve with critical services, educating them about critical services, doing things like offering travel vouchers and transportation services, which address the social determinants of health, providing awareness and advocacy to these organizations to amplify the voices of BIPOC birthing people and their needs. And so they sort of stand in the gap between the awareness and advocacy for families, and highlighting those critical policy and system gaps and advocating for improvement. Same thing, standing in that gap. And also connecting and strengthening systems. So with the information that is provided or utilized and learned, in the ways in which we work together, organizations are able to create those needs in the community or strengthen those needs in the community and provide information about those needs in the community, catalyze those through advocating for those in the community. And we'll talk a little bit more about that as we come up in how that has played out. I also want to note here that in our work, we have noted that CBOs, we define CBOs or community-based organizations as social enterprises as well, because we recognize that agency and community and desire to build generational wealth while making critical social impact is also a part of the conversation. So we did not want to just define it as small organizations or, NGOs, but also as businesses, social enterprises. And I personally relate to that because I am a business owner as well. And having a business structure just provides a level of autonomy in this process as well that I think is important, and we discovered actually is important through conversations and through our research, which we'll talk about in a moment. So one of the critical pieces of the work of the Alliance was to assemble a community advisory committee. So this community advisory committee is really the committee that stewards the initial $500,000 fund that the Alliance put together. And they set the priorities, the goals, and the ways in which we evaluate applicants. The CAC, as we call them for short, governs that. And so as you can see, all of the CAC members, the 10 CAC members, are people with lived experience and expertise in birth equity. And they provide strategic direction, not just in creating the RFPs that are put out. Our first RFP was last year, and it was around postpartum equity and support. And one of the things that I have to note is that when this RFP was created, that wasn't a strong conversation among funders and in the birth equity community, the ways in which postpartum care is so essential to maternal mortality. But because of their closeness to the ground and their wisdom about what is happening in the community, they were able to pinpoint that, and we were able to provide grants to grantees who are providing critical services in the community around postpartum support. And so just to give you an introduction to our community advisory committee members. In 2022, we actually gave almost $200,000 in grants across various grants, including rapid response grants, to organizations that were responding to the formula and diaper shortage in New Jersey, and to our postpartum equity support grantees. This year, we have another grant that we are releasing, and we look forward to being able to provide grants to organizations, small organizations that are providing support in the ecosystem of wellness and birth equity, and really looking at social determinants of health. And another thing that is very critical to note is that we provide grants for organizations that would not typically receive grants. And what does that mean? That means that we typically, first of all, our applications are simple and short applications that ask for information that is critical and germane to receiving the grant. Our requirements for receiving the grant are, we've reduced the barriers to what those requirements are. So, for example, the threshold for your annual operating budget for our first grant was $250,000 and below. And for this grant, it will be $500,000 and below, in response to a conversation and an understanding that we have that the definition of smaller organizations, as well as the projects that organizations may have, can require some more an increase in the amount that we see as a small organization. And so we're excited to be able to provide that, because the majority of our grantees from last year were grantees that had never received grants before. And so this is the kind of responsiveness that we would like to provide in funding. So we do our work through the lens of participatory grant making, and the CACR Advisory Committee was built upon the following participatory grant making principles. So, as Ashley discussed, just really looking at the needs of community and responding to communities. So involving community members in all stages of the grant making process, from determining funding priorities to evaluating grant applications and monitoring progress. So again, the CAC is involved in each of those pieces. And not only that, but is also, we have our alliance meetings, and we have our advisory committee meetings, and those groups meet together and have conversations together to provide conversation and information with one another about what is happening in birth equity, so that we're all learning together and co-learning together, which I think is critical in the grant making process. One of the things that we implemented this year was having funders come in and talk about their grant making and the way that they do grant making with our advisory committee, so that the advisory committee can have this intentional learning around how funders do their work, how they think, and what their work has been historically and how they're shifting. Participatory grant making also includes providing opportunities for community members to learn about and participate in grant making through training workshops, just as I stated, being intentional about having opportunities for learning with the community members who are in that process, so that there's a two-way street, three-way street of learning among the advisory committee as well as the funders. Prioritizing grant making to grassroots organizations rather than larger established institutions. And so this is a conversation, again, that we've had, where even in larger organizations, sometimes they can have projects that are not as well funded, but wanting to really focus on those grassroots organizations that wouldn't really have the opportunity, may not have a grant writer and the capacity to do applications, longer, more robust applications. And so ensuring that they have the opportunity to engage with philanthropy in this way. And being transparent about the grant-making process and decision-making criteria, and providing clear and regular feedback to grant applicants. So in the grant, our previous grant, we ensured that we laid out the steps and what was next for grantees. So we had a Q&A once the RFP was released, for example. We also, for those who did not receive grants, we did provide feedback on improvement of grant application or future grant applications to our organization or perhaps to other organizations. And so those steps of really being engaging is something that we've heard from the community is important. And so we wanted to make sure that we infuse those into it, because one of the things that we hear a lot, and you'll hear grantees talk about, is the lack of feeling of being connected to the funder, or that the funder actually cares about the work that you're doing outside of the check-ins that is done to provide data, et cetera. And so in order to truly be community focused and community centered, we want to make sure that we provide those touches to our grant making processes. Another area that was critical to our ability to do this work was to commission a CBO landscape research process. And so we worked with a organization, a Black woman-led organization based in New Jersey, to really find out who the actors were in New Jersey. Who are these CBOs that are doing this work, and what do the people that they serve need? What do they need, and what do the people they serve need? And really desiring to be responsive to this information, we tried to make sure that we are utilizing this information to create programs and to connect organizations with opportunities for learning and advocacy. And so one of the things that we discovered was that individuals' access to the services that are high in demand are housing, transportation, and language assistance. And so the communities that are served are in need of these services, but they may not have as much access to it. So one of the actionable ways that we've used this finding is to connect birth equity actors with government agencies and efforts to advocate for maternal health carve-ins and considerations. So for example, we recently did a training and learning session around the Medicaid 1115 waiver. And then with that came the opportunity to be on a work group or on work groups that will impact change in maternal and child health. Because with people in those spaces and with the seat at the table, so to speak, they are able to then advocate for the needs in maternal and child health. The other area is the perinatal workforce burnout. So actionable use of this finding is that we are currently in process of development of a perinatal workforce wellness fund. And so this fund would serve to be a responsive fund to meet the needs of birth equity actors such as community health workers, midwives, and doulas, to ensure that they are able to access funds to care for things that they may need to care for. Because we know that while there has been a lot of work in birth equity in New Jersey to ensure that maternal mortality is reduced and eliminated, our workforce is burnt out from meeting the needs of its citizens. And so oftentimes we hear that, for example, if doulas are accepting Medicaid, they get paid late, right? But your needs, your bills are on time. They need to be paid on time. And so the point here is to be able to provide that, fill in that gap for these perinatal health workers to meet the needs that they have in the meantime, and for it to be a self-sustaining fund where perinatal health workers can also contribute to the fund, but also funders can contribute to the fund to serve the needs of our workforce. The final thing is complex applications and criteria for developing organizations. The same organizations are receiving funding. So we heard this in the research findings, that the same organizations are receiving funding. And so we wanted to ensure that organizations, again, that would not typically receive funding are receiving it. So we have a simple application. The questions are centered around being mission-driven, We are asking for self-defined metrics criteria and targeting organizations, again, that do not typically receive funding. And so in order to do that, we have to really be in the community and be trusted in the community as a source for interacting with, being interactive. So this research really provided a lot of base for the work that we continue to do as well. So I wanted to put this up to give some kind of source of conversation around what the difference between trust-based philanthropy and traditional philanthropy is. And so I'm getting a time check, so I don't want to continue to talk too long, but some of the basic things are, instead of grantees, thinking of what we would consider grantees as partners, right? Instead of working autonomously as a funders collaborative, we're working in collaboration with one another. Instead of being agenda-driven, being participatory, right? And that lends to being more patient in philanthropy, because in order to be in conversation and then process those conversations, you need more time to do that. And so this is just something to think about for philanthropic organizations and individuals to think about with their own practices, and how perhaps you can lend to shifting. You don't have to shift everything at one time, but even if you can shift one thing, it can make a difference to start. And so just looking at some of the results of the Alliance, our pooled funds have committed to funding, our four initial funders, we now have 6 funders, have committed to funding over $2 million since 2021. Our grant making focusing on the issues, those who are closest to the issues on the ground, and BIPOC community leadership by making technical assistance and general operating grants. So again, one of the things that you will often hear small organizations will need is general operations. So if you're working on a project, the project still requires administration, right? And that's the general operating task. And so just thinking about the different things that actually impact the organizations that you are working with. Transformative philosophy, community informed and led, our CAC, our advisory committee, and from capacity building to systems change. So what are we building capacity for, right? And so thinking about that and thinking through that, then we'll see that really we need a systems change, so that there isn't this constant loop of just changing from one thing to the next it looks like change, but it's really not. So it needs systems change in order for that to be the case. So our call to action. Our call to action is to embed participatory practices into decision-making to ensure community voice and solutions are upheld. Make efforts to fund organizations that would not typically receive funding, and challenge funding policies and practices. One of the things that I'm very proud of is that this year we will be able to fund business structures. So in our last grant, we were able to fund small NGOs that now we're going to be able to fund, and individuals, but this year we're going to be able to fund business structures, which goes back to the expanded definition of CBOs that we discussed earlier. And find ways to collaborate with stakeholders in every aspect of decision-making, project development, and project administration. So think of ways that, if you are thinking of it being done one way, is there another way that community would think of it, right? So thinking of that consideration. And you can learn more about our projects and our grantees on Instagram and LinkedIn at Birth Equity Alliance or birthequityalliance.com. And it is a pleasure to have spoken to you. And I know if you have any questions, please feel free to put it in the chat. I'm pretty sure I missed something, but it's okay. If you have any questions, please feel free to ask.
Thank you so much for that presentation and for the important calls to action. As Cecile mentioned, and actually we're twins today, my little one is We've opened up things for Q&A. You can drop your question in the chat box. You can use the Q&A feature, or you can raise your hand and we can unmute you. If you'd like to verbally ask your question and you're dialing in by phone, please press *9 to unmute yourself. And we've already gotten some questions underway and some preliminary responses, but I'll just read them out for the panelists as more questions come in. The first question is around whether any of your organizations help to pay for midwife doula trainings for community members.
Yeah, are you okay if I start, Cecile? So we created a program called the Doula Passage Program. And the intention behind this program, again, taking the collective action framework, is that in Nebraska, there was not a bench of Black doulas. There were maybe a handful, like literally 8, that were practicing and not all full-time and providing support to Black pregnant people. And so when we created this program, we leaned on partners that were multi-sector. So we had traditional folks from our hospitals, we had folks from our federally qualified health center, we had doulas that were full spectrum doulas, lactation consultants, again, a mix of folks that said, help us think about this program. And so we pulled together the curriculum to train 40 Black women and as full spectrum doulas to help get them into the field to start to provide support. Not only did we pay for their training time, so they received an $1,800 stipend for the 10-week learning period. We then helped to provide reimbursement for their clients that they needed to have, as well as a revenue source through other like pilots and other programs, because we know that folks can't do this work for free. And the ways that we connected it to our economic justice work. So we know that, and I love what you have to say about like the business ownership side and like, what does that look like? And so kind of in that same frame, we were like, well, folks need to operate like a successful practice. Like this is a business. And so we took our business accelerator program and we tailored it specifically to the niche field of doula practice or community-based birth worker work. And so outside of getting the technical skill that we paid for, here in Nebraska, it was tailored to our geography and what we saw, the competencies that were needed. We also put them through this business accelerator to help them understand how to run a successful practice so they could, again, go into this work full time if they so choose, or just understand the implications of being a business owner. Not all folks understand the taxes associated with it, or the liabilities and insurance that you need to have. And so we took this different approach to thinking about building capacity specifically for doula work and paying for it, and build that in-house, as well as with in-house expertise from Nebraska.
Yeah, thank you, Ashley. So we do not pay for training specifically, directly, I should say. What we are lucky that in New Jersey, there are a lot of doula training efforts and through various outlets. And so what I have noted, and I will note, is that some of our grantees, for example, one of our grantees has a doula agency. And so she has trained doulas through receiving the grant. So particularly specifically postpartum doulas. And so that is, I guess, an indirect way of training doulas in a particular area that usually in New Jersey, doulas are trained full spectrum. So having had postpartum doulas trained specifically through that postpartum equity support grant, I guess provides that specialty in doula training.
Yeah. And just to add, right, Cecile, maybe fair to say, many of the members of the New Jersey Birth Equity Funders Alliance do fund that work through their individual foundations as well.
Yes, absolutely. Mm-hmm.
Thank you all. Another question we received via the chat is if there's a way to become involved in the Black maternal health collaboration, or at least receive updates from it.
Yeah, so feel free. Like I said, Jessica is in the chat. So I dropped her email in there. It's jessica@ibyblackgirl.org. It's also on the website. She can get you engaged in our Maternal Health Coalition, as well as if you subscribe to our newsletter, then you can get updates on like what we're doing, what that research looks like that she's putting together, all of that.
And I know our colleague Alex has a slide at the end, which has some other links to some of the collaboratives working in birth equity as well.
Great, thank you both. The next question I see is, does any of the foundations give grants to countries in Latin America? Greetings from a feminist fund based in Mexico.
Yeah, happy to jump in here. We used to work more in global maternal health, so I'm happy offline to share some resources. Our work right now is very US focused. That said, there's certainly, I saw in the chat, there are a lot of learnings we should be doing more, and frankly, less like US ideas and money going into the global South, and frankly, more thinking about the lessons that we can learn from the global South to think about for this country. So would love to see more of that dialogue.
Great, thank you. We got a question about what our panelists and other guests see as the role of corporate philanthropy in supporting birthing justice in the US.
I mean, I can jump in and say a little here, but so we have 2 organizations that represent corporate philanthropy. And so there is a role, I will say that. And I think that, you know, it usually lands under corporate social responsibility, right? And if you look at just a broad consideration, you know, 50% of our workforce is women. And, you know, families are impacted by this issue. And so, you know, why not? I guess the question would be, right? How can you create a situation where in your corporate giving, this is a critical issue that you provide support for? I know that, you know, we've been very lucky to have sort of individuals within those spaces that have lived experience and that focus specifically on women's health concerns. And that's specific, but if you look at the broader issue, I think it's a concern of everyone. And so I think that, you know, there's definitely a space for it in a way to have a story for how that can and should be supported.
I just would piggyback on that from an advocacy perspective. And so like what we've seen here are corporations will, like, they'll give money, they'll sponsor our summit, engage that way, but they're not using their lobbying power to make sure that there's policies that support the $20,000 that they gave for that sponsorship, right? Like, folks are not willing to touch reproductive well-being from a holistic perspective outside of maternal health. So like, you can't fund maternal health work if you're not willing to talk about reproductive rights and abortion access. Like, they're mutually exclusive. You have to have those conversations. And so corporations have a lot of power, influence, and I think we have to start imagining, how do you use that to benefit not only just your workforce, but the surrounding community that you are a part of. And a piece that I don't see corporate philanthropy or that corporate responsibility that you named, Cecile, is doing that. And so I think that is a place where corporate philanthropy can lead and really step into in a very different way than it has been.
Yeah, and I think Ashley, oh, I know, Alex, you want to say something too. And just quickly, Ashley, on that, I couldn't agree more. I mean, I think what I hope is that the work the corporate philanthropy is doing is like talking to the corporations themselves. Why aren't they including doulas and perinatal CHWs in their medical coverage? Why aren't they raising their minimum wage so that people have thriving wages? I mean, I think we can't, I know often corporations want to keep a pretty firm wall between their philanthropy and their corporate practices, and I think it's our job to really challenge that. But Alex, I think you were going to chime in.
No, you all really covered. We've worked with corporate philanthropy for nearly 15 years and watched that pathway. Ashley, you covered it so perfectly, where I think corporate philanthropy should enter in the same way any philanthropy does, in really a listening and learning way, which is, I think, what we're seeing a lot with the corporate philanthropists that have joined the New Jersey work with Cecile. But there's these tools right there. If you, depending on the focus of your company, certainly I think there's actually really ways to actually partner and influence your business units, whether it be products or others, and in order to really align better and learn and have a step towards like a community of consumers that you haven't been as close to before. But I think the other piece that's often overlooked is actually what you said, and we've seen some movement on this, which is revisit your own internal policies, as well as really look at the work as of advocacy that corporations can do. And there's been some really interesting work, and I can send a link that from RIA Ventures on really trying to look at putting pressure on investors and shareholder advocacy to try to push from that direction to get companies, and I'm going a little track from corporate foundations, but to really push that same activity, Ashley, that you're asking for companies to really stand up in their states in a different way and show up on behalf of their employees. And so many companies and corporate foundations have money allotted to the area that you are based in and your community, and a lot of it goes to sort of important employee giving priorities, but there's a way to sort of redirect it to some of the issues that are probably in your own backyard related to birth justice. So it's a wonderful question, and thanks for bringing it up.
Thank you all. We have another question around whether either of your organizations have resources or broad suggestions on what to look for when vetting funding opportunities. I don't know if you need more clarification.
Yeah, I can start. So I'm assuming like if we're vetting a funding opportunity or org is what they look for. And so I have been, as like the leader of the org, very clear about what funding relationships and partnerships look like, and not all money I will take or want to be a part of. It's really important that the process is as important as the product. So like, yes, as a funder, you may want to advance solutions to address the Black maternal health crisis. So do we, but we have to be value aligned. We have to think about how we work together. Like, are you going to have and embrace trust-based philanthropy practices where, you're giving unrestricted operating dollars, it's multi-year and we're in conversation, or are you checking in with me every month? So I'm spending 20 hours a month trying to address you as a funder versus doing the work. And so like, when we are vetting opportunities, we have this framework that we say, what does it look like to really be in partnership with philanthropy? And that it's not this power-based relationship where this person gives money, now they can dictate the work and really co-opt what we're trying to do from a leadership perspective. And so we look at the RFPs, we ask those questions, we ask the funders that we have great partnerships with that align. Hey, can you introduce us to like funders? Can you tell me about this funder? Like, we're really transparent in that process, but that can be scary for an org, right? That is their earned revenue is from philanthropy. And so you have to decide, in my opinion, what works best for you and what that process and agreements look like. But for us, that has been our approach here at IB Black Girl.
Yeah, same here. We have a charter that is, agreed upon, and a memorandum of understanding that is agreed upon, and those measures are, excuse me, clear in those documents, in the conversation. And I mean, it's quite frankly has not been an issue. I think that everyone comes to the table with the understanding that this is the way that we function and the lens through which we operate. And this is what has been done and what we are doing. And that we, even in the process of developing and growing, we're learning how to do it even better. And so, yeah, when vetting funders, I guess you could say, that is, we lead with our principles and values in the way in which we have been working. So.
Thank you for that. And we have about 5 more minutes for questions. But as I wait to see if any come in through the chat or if any hands go up, we actually have a question for funders in the audience. Does anyone want to share any examples of how they've moved more towards trust-based philanthropy and a focus on maternal health or birth equity or justice?
Can you repeat the question? I'm sorry.
This is also for our funders in attendance in the audience, if they have any examples of how they've adopted trust-based philanthropy principles, or if how they're building a focus on maternal health or birth justice.
Well, okay, I'll let somebody else. Did somebody else want to
Sam has dropped the question in the chat. Feel free to respond in the chat, or you can raise your hand and join us.
So I'll just say that, again, the lens and the framework is trust-based philanthropy. So having the community advisory committee is a huge piece, and the community advisory committee functions and operates in autonomy, and so really does set the priorities and evaluates the applications and sets the way in which things are done for giving grants. And so that in and of itself, I think, is a huge giving of trust-based principles there, and adopting that principle and working in that principle. Now, in that, of course, there's a lot that has been learned and unlearned by the collaboration of funders, right? So some of the barriers may be, for example, that the learnings that the advisory committee and learning about philanthropy and what philanthropy is and how it functions, and so being able to use those and translate that information. There's a lot of unlearning that some of the funders have to do, right? So when there's a heavy reliance on data that is numbers based and not narrative based, and there can be a challenge with funders perhaps understanding or relinquishing control over that thought process that the numbers is what speaks the most volumes. And so that is something that we have seen and been able to work through and have conversation around, and are moving towards learning new ways to present data and information. The other thing is, just general capacity. When you're dealing with community-based organizations who have never received funding, there's a different way to engage, right? So, we have to go through the process of community-based organizations trusting us and wanting to apply, even though it may be a simple process, wanting to apply and wanting to and trusting to accept this process is that simple, right? So there's a lot of, but that we get around that because we have a CAC and members from the community who are in the organization and doing the work. And so, when things arise, I think the buffer is usually that we have community members that are in process with us. And so, yeah, I will say that for some of the examples.
Thank you so much. And thank you to all our panelists for today's really thought-provoking and timely discussion. For the last few minutes of our time together, wanted to shift to closing out. I'm going to hear from Alex. But in the interim, I just want to drop a link to the registration page for our conference. Women's Funding Network is putting on a conference in September called Feminist Funded 23. We're launching our conference website this week as well, so stay tuned for that. And the reason I bring up our conference is because we'd like to continue this conversation around birth equity and birth justice at the conference. We'd also love some feedback, if you want to do that in the chat or raise your hand, on what we might cover in the in-person convening. It seems like it might be interesting to have a dialogue about birth equity and justice from the U.S. perspective versus the global perspective, for instance, based on what came up in today's discussion. But please, again, drop in the chat any topics you might be interested in this group covering, and that will inform the session. And I'll turn things over to Alex.
Thank you, Miranda. And thank you again for letting us join this. And I think the most important thing to call out is just to reinforce, Ashley and Cecile, the really important messages throughout your calls to action, which are very much about what to fund, but also about how to fund being so critically important, and the amount of work that funders really need to do beyond just identifying the next thing to fund. And so I wanted to just close by calling out some spaces where funders are taking the advice that was given today and really doing the work internally to change systems practices. And I'll just take us to the next slide to say funders, just a call out to a few good resources. Funders for Birth Justice and Equity is really playing an important aligning role at the national level. As Wendy mentioned, we'll be holding the summit again next year as an important space for funders to continue to push themselves to really evolve practices, invest more resources, really meet the calls to action that were shared today. And there will be a funder landscape release, which will also serve as an organizing mechanism to know what's currently happening and start to identify gaps and really have more aligned activity. We also heard from Wendy about the state of birth equity work, and that is one place, but there are many to really look at the state level funding opportunities. And I just love that Ashley and Cecile today brought two different state examples, because shoring up state funders in a way that Ashley was highlighting hasn't really been sufficiently done at Nebraska state level before, and bringing that consistency in funding at that level is so important. So please reach out to Lindsay if you're interested in learning more. And then there's also areas that are really looking at this as an intersectional issue that it is. This is one example of a funder collaborative, but Funders for Maternal Mental Health is a really excellent community that has a pooled fund that is really looking at that intersection being one of the really important areas that have been underfunded but are connected to important outcomes. So we're just excited. We are just a connector of other organizations and opportunities. There's so many out there. Sona has shared a bit about what Ms. Foundation has done. So there's also really amazing funders to look to who've been in the space for longer that are really holding up both the practices as well as the commitments to resourcing the work and really building on the advice that Ashley gave to the field. So thank you, and back to you, Miranda.
Okay, just want to again thank our panelists and thank everyone who joined us today in the audience and stuck around for the 90 minutes. We appreciate you, and we hope to have you join us for the continuation of this conversation at our conference. I'm going to drop my information in the chat. Feel free to reach out if you have any feedback or any questions, and have a wonderful rest of your day.
Thank you.